video we're going to have a look at the Thomas test. Thomas test setup, what are some of the key findings we can take from this test, and then possible treatment indications following that. So different ways you can get into the position to start with, but normally an easy way, if you've got a nice heavy table like this with no risk of the table flipping and being sort of flimsy, is to have the patient sit right on the edge of the table, grabbing onto one of their legs. So I'll get Rob to grab onto his right leg in this case. Trying to think about where the head will fall when they come back, and have a pillow placed there so that it lines up nicely. One hand over the patient's hand, and then just supporting as the patient rolls back, and then just adjust that pillow as you need to. So from here, now that the patient's back, we just want to come around to the side and make sure that the patient's right on the edge with their hips. And normally what will happen is they'll be a little bit too high up on the table, so we need to get them to shuffle down. An easy way to do that is, if you've got a patient that's fully clothed, we can come around the side here, feet go up onto the chest, and then if we get you to hang onto the side there, Rob, and just shuffle down this way just a little bit. Yep, that'll do. And now what we'll do is get you to hang onto that side again, and now we'll let this one hang free. All right, and now this is a good position, sort of where they are on the table from a superior and inferior perspective. But now the other key thing we want to do to ensure consistency every time with this test is to check the pelvis position. So what I like to do with this one is I'll have this foot up on, for me I'm comfortable on the chest, but females obviously you'd go on the side, or you could even just control here and that could hang loose. So there for me, this hand I'm going to come across and have a palpate for the ASIS. And what I want to see with that ASIS is it's not too superior and the patient's in a posterior tilt, and it's not too relaxed and they're not relaxing into an anterior tilt, because both of those things are going to result in false positive test results. So Rob, I'll just get you to relax here for a minute. And what we're going to do is going to find that ASIS, hook in underneath. And then what I'm going to do, I'm going to just go into a bit of a posterior tilt and let it go into an anterior tilt. I'm just going to find that midpoint. Now that I've got that point I'm happy with, Rob, I'm just going to get you to hold on that leg and just maintain that hip flexion angle. Yep, and now I can let that go relaxed, and just relax that out a little bit, Rob. And now it's in that same position that I had before. So I'm happy with that position there. Now what I'm going to do, just to check the lumbar spine, just to make sure it's maintained that neutral lumbar lordosis, just going to slide my hand underneath, and it should feel like we've got a little bit of a lumbar curve there still, and it's not in flexion. If it's in flexion, what it means is we've got a full, or not a full necessarily, but an increased posterior pelvic tilt and increased lumbar flexion. And what that will do to our test is it'll give us a false positive, and it'll tell us that Rob's tighter in these muscles than he actually is. So now that we're happy with that position, coming side on, and what we want to see is 10 degrees of hip extension through the thigh. So we've got that there with Rob, and then with our knee we want to see that sort of straight down or a little bit extended. So with Rob there, we've got a little bit much of an angle than what we want. So what that indicates for Rob is that iliacus, iliopsoas, we're happy with the length of those, but his quadriceps are potentially holding too much tone there, so we do some work on that. So that's our Thomas testing setup and our indications. If it was iliacus, iliopsoas that was tight, we'd be up here like this. So that's the two main findings. Okay, so from here what we'll do is we'll go into an MET technique for both of those different findings. So the first one we can do is, Rob, you can relax there now if you'd like. We'll do a mock scenario now where Rob is actually in a little bit of hip flexion. So if that was the case, what we could do for an MET technique, we could just push down here a little bit until we get that R1 barrier, and then we can just get Rob to do a little bit of hip flexion, so not much at all. And again, 5 seconds. And then as he relaxes, really just let the weight of the leg drop. Don't need to put too much overpressure. And then you go to the next R1 barrier. So that would be how you do a hip extension MET for the anterior thigh, iliacus, iliopsoas muscles. So the indication for that again is if your patient is up here and not in that -10 degrees of hip extension. The other one, which for Rob is a perfect one, because it's indicated, is for the quads, is to blink over like that with your foot, take it into a little bit of knee flexion, and then just get Rob to do a very light kick into my foot there.
Okay.
No more than 20% effort. And relax. And as he relaxes, going to that next R1 barrier. So with this, it's a little bit awkward because you're on one leg. What I'm trying to think of as the practitioner is just taking my foot down towards the ground, because then I've got nice sort of stability while I do that. But take into account how much of an increase in flexion that is, and that could be a massive stretch for our patient. All right, and we'll just get you to hold on there again, Rob. The other option with this finding where you've got the knee extended is to then flip the patient back into prone and do a prone knee bend MET, which we've demonstrated in another video. All right, so from there, Rob, we're going to get you to sit up again. So I'm just going to give you a bit of a hand.
Thank you.
Yep, no worries.